Clicking accept. So hi everyone. So excited for everyone to be here. This is really exciting. This is my first time moderating anything. So very grateful for the vote of confidence. We are here tonight to talk about all of the really ridiculous political attacks that have been levied against reproductive freedom, particularly during this pandemic. And we wanted to ask the activists and leaders and experts to really ground us in what is happening and center the conversation around the fight at hand and what's to come and what we can do about it. So our goals this evening are to give everyone some clarity and some tools around what to do in this crisis. So just so everyone knows, my name is Lauren. My pronouns are she, hers. I'm the Vice President of Member Engagement here at the Identity Credit Club. And very excited to introduce our panel of experts. And we will start with Shannon Hovis, who's the ED of NARAL Pro-Choice California.
Thanks, Lauren. Hi, everyone. So yes, I'm Shannon Hovis. I'm the Director for NARAL Pro-Choice California. My pronouns are she, her, hers. And just to give you a little bit of background on NARAL, NARAL Pro-Choice America and our network of affiliates and chapters is the oldest and largest abortion rights organization in the country. And we are grassroots organizing. So we are almost 3 million strong nationally with 270,000 members here in California. And we are working to elect pro-choice champions who will stand for reproductive freedom and pass policies in that regard. Historically, we have been known as an abortion rights organization. We have expanded significantly over the years to include really the full scope of what reproductive freedom is. So there are 4 pillars to our work: fighting for contraception, abortion, fighting against pregnancy discrimination, and any form of discrimination against pregnant people, and also fighting for paid leave. And within that, we do a lot of maternal and infant healthcare work as well. Really glad to be here.
Thanks, Shannon. And then Heidi Sieck, founder and CEO of Vote Pro-Choice.
Hello, everybody. Thank you, Lauren. My name is Heidi Sieck, and I'm the Chief Empowerment Officer and co-founder of Vote Pro-Choice. I'm so happy to be back home in San Francisco, even virtually. So I'm coming to you from New York City tonight, but as we were talking about earlier, my heart is always in my home of San Francisco, my political home too. So hi, and thank you for all the work that you do. Vote Pro-Choice was founded in 2016 as a voter guide. Our goal, we're actually a project of Democrats.com LLC, which is has been around since about 2000, and we're a national digital marketing organization, or a digital marketing firm. And what we wanted to do in 2016 was give pro-choice voters a tool that will help them vote all the way down their ballot, because only about 15 to 30% actually finish the ballot. And the thing is, reproductive freedom is absolutely essential in every single race, and we'll talk about that during this panel, I would imagine. And I learned that from all the work that we did in San Francisco, that a city council member who introduces something to protect abortion clinics can go all the way to the Supreme Court. That's the project that Malia Cohen and David Chu and NARAL California and the San Francisco Women's Political Committee and Planned Parenthood of the Bay Area, I can't remember what the name of it was back then, where we work together at the local level to try to protect reproductive freedom. And that's why it's so essential to vote pro-choice all the way down the ballot. So that's what we intended to do in 2016. And we did not have the outcome that we wanted. So we expanded our services to be both the largest pro-choice voter guide in America. That is every election, everywhere. We provide a recommendation for how to vote pro-choice in every single election, and we're going to be doing all 50 states, 95,000 races on the ballot in November. We also endorse pro-choice champions in down ballot races where reproductive freedom is at stake. So right now we are working on a project in Georgia for the primaries on June 9th, and we're going to be supporting a bunch of really amazing down ballot candidates there. We work in partnership. We work in collaboration with partners like NARAL, like Women's March, like all the local and national organizations to be able to support and amplify their work as well. So I'm really happy to be here, and I'm so excited to be home.
Thanks, Heidi. Next, we have Ladawa Salazar. She's a board member of Access Women's Health Justice.
Hi, my name is Layidua. I am with Access, and we are a reproductive justice organization. We were established in 1993 by clinic escorts who got an opportunity to hear what people who were getting services had to go through to even get to a clinic. So we started as a practical support network, and due to a clerical error, what would have been a very localized support became a statewide support. So we grew kind of overnight, and we provide practical support that's everything from funding to getting folks from their cities to wherever it is that there are services, as well as providing overnight stay, and doing logistical coordination. We also do movement building, advocacy work, and community actions.
Amazing. And last but not least, Sophia Andary from the Women's March San Francisco, and is a commissioner on the Commission of the Center for Women in San Francisco.
Hi, everyone. My name is Sophia Andary. I'm a founding member at, my pronouns are she, her, hers. I'm a founding member and co-chair of Women's March San Francisco. And as stated, I'm also a commissioner on the Commission of the Status of Women of the County and City of San Francisco. Women's March San Francisco is an international, intersectional movement with humanity and equity at heart. And the Commission on Status of Women works to provide equity and advancement of women and girls in San Francisco.
Great. There's a couple more folks hopping in here. So Heidi, I want to start with you. Last week, there was a documentary that was released called AKA Jane Roe, and it revealed some pretty shocking information about Norma McCorvey, who was Roe in the landmark case Roe v. Wade. And it talked about some of the anti-choice efforts to manipulate her and create a narrative around her stances around pro-choice. Can you walk us through what happened there and what it means for the pro-choice movement moving forward?
Mm-hmm. That was really disturbing, wasn't it? That was a disturbing documentary. But who was surprised? I wasn't surprised. Okay, so I think, first of all, it's very important for us not to center this discussion on Norma McCorvey, but to think about the infrastructure around her that paid her off. And that's what we really want to get real about. So Roe v. Wade was the Supreme Court decision handed down in 1973 that provided constitutional baseline access to abortion with some restrictions. She happened to be the woman that was the person that was the woman filing for that. She's, as you know, Jane Roe. And ever since that decision has been handed down, reproductive freedom, specifically abortion, and even access to birth control, has been a political issue that has been strategically manipulated by the anti-choice infrastructure to be able to maintain power. So fundamentally, the issue of reproductive freedom and the limits that have been placed upon it are about power and control. Around the late 70s and 80s, the Republican Party realized that they absolutely had to make abortion an issue in their in order to continue to get presidents elected and to keep the extreme radical anti-choice minority connected to the political strategy at the time. And so they invested millions of dollars over the last 40 years to have an infrastructure that could do something like pay off Norma McCorvey so that she would become the the former person that Roe v. Wade was built on, and now become this Christian born-again anti-choice spokesperson for the anti-choice movement. And that's the kind of infrastructure that they've been investing in because they know that they have to in order to maintain power. Now, two things I want to say before we go to the next question, which is the fundamental thing to remember is that we are a pro-choice majority nation. About 82% of the people in this country do not want Roe v. Wade overturned. We want abortion access in this country. We want reproductive freedom in this country. That means that we have the majority of people, yet since over the last 30 years and the last 40 years, hundreds and hundreds of pieces of legislation have been passed to limit access. Supreme Court decisions have been passed, and Shannon will talk more about this in detail, I'm sure, and constant restrictions. And more frighteningly, anti-choice judges are being both elected and appointed at every level of the judicial system to strip away our rights, but they do not reflect the pro-choice majority. So Norma was just a pawn in the infrastructure game that is vastly outsized in its reflection of the existing community. Meaning, we are a pro-choice nation. This anti-choice minority is just better. They have better infrastructure than we do. So that's what's really important for us to remember. More of us than that. And I mean, I appreciate that Norma came out and told the truth so we can actually expose the reality of that infrastructure and start to organize against it and be real about what our options are and about what power we actually have.
Thanks, Heidi. Thinking about how their power was so outsized considering they're a small minority, I think it's important to talk about the language. And as someone who's newer to this space, both in my activism life and in my professional life, I hope that we can talk about the differences in the terminology and what they mean. So Ladawa, as someone who works in a service-oriented space at Access, can you explain the differences between reproductive healthcare, rights, and justice, and why those differences are important for everyone who wants to be part of this coalition and in this movement?
Sure, and it's Layidua. So reproductive health is healthcare that focuses on the reproductive system. So everything from family planning to women appointments and abortion. Reproductive rights are both the laws that govern that healthcare, as well as a movement that advocates for those rights, and it's largely often identified as a pro-choice movement. And reproductive justice, differently from reproductive rights, is a movement started by Black women and women of color who felt marginalized by the reproductive rights movement, with an acknowledgement that when it comes to reproductive health, for women of color, it's not about rights, but rather justice. It is, and that as a movement, it was impossible to just focus on abortion when women of color are being forcefully marginalized. Reproductive justice advocates for the right to parent or not to parent if and when we choose to do so with support and dignity.
That's great. I think that's really helpful. I know for me, I learned a lot about those differences and how they work together, but also are distinct. Okay. Thinking about what's happening on the ground every day. So even today in Tennessee, there was a legislative committee that passed a 6-week abortion ban in Tennessee. It's probably not going to pass in the state, which is good, but it's still a little bit terrifying. So Shannon, can you talk about how NARAL is responding to these just completely anti-choice, totally out in the open anti-abortion bans? that are popping up everywhere.
Yes, definitely. Also, just to piggyback really quickly on what Layidua was saying about these terms, for NARAL, the term that we use most frequently as far as what we are fighting for is reproductive freedom. The freedom to decide if, when, with whom to have or grow a family. And that freedom means free from any kind of oppression, right? Which I do think also really gets at what is so much embedded in the importance of fighting for reproductive justice, and the reproductive justice framework is recognizing that there are all kinds of ways that historically our reproductive systems as women have been used to oppress us, and even more so for women of color. So I do think that thinking about it in those terms is also worth mentioning. So specific to these bans, just this year, 13 states have made an effort to ban abortion by specifically weaponizing the COVID-19 crisis to do so. And so I just want to kind of walk through how they're doing that. Essentially, it's them saying that abortion is not an essential service, that it's an elective service, and therefore doesn't need to be provided, in fact, cannot be provided in the state. So Texas was probably the first instance that you heard about. Governor Greg Abbott came out and he said that abortion is elective, and not only that, but if a provider provided abortion in the state, they could face jail time or a fine. So it was like really going the next step to criminalize abortion care. And this is in spite of the fact that, you know, the American College of Obstetricians and Gynecologists and other leading medical expert organizations have made explicitly clear abortion is essential. It is time-sensitive care. It cannot and should not be delayed. And even though the American Medical Association has come out specifically to chastise these anti-choice leaders who have made efforts to do away with abortion in this moment. The other thing I think is worth sort of contextualizing is just that this is essentially abortion ban 2.0. So last year we saw the first wave of abortion bans where 31 states introduced, passed, or signed legislation to ban abortion. I'll say that again, 31 states, and it's an astonishing number that actually introduced legislation in that vein. None of those abortion bans, of course, are in effect because Roe v. Wade does still currently stand. But if you look at the overlap of the states that are trying to weaponize this pandemic moment to do away with abortion access, that almost is a very, like, it's almost a circle with the states that also tried to ban abortion last year. So what are we doing? I mean, I guess the crux of it is just that we're fighting back and we're organizing in a whole variety of different ways. So one of the things that we know, and Heidi alluded to this earlier, is just that the anti-choice folks, they are a very strategic and successful in some ways mechanism. They are very well funded. They have been extraordinarily sneaky in how they've really mapped out the entire landscape and tried to infiltrate the judicial system successfully. State legislatures across the country, their network of fake clinics, I mean, you name it, they've built it. But they are the minority. They're a serious minority. And most recently, we saw a poll come out that indicated that 65% of the American public does not like what the Republican, right-wing, anti-choice establishment is doing right now to try to weaponize the COVID-19 crisis to do away with abortion access. In fact, just 21% in that poll overall supported these actions around COVID-19 anti-abortion policies. So one of the things we're capitalizing on is running ads that really call out both the pro-life hypocrisy that's going on, where you have these like so-called pro-life folks who are then opening up their states and totally exposing people to a lot of risk. We are also running ads that specifically target Trump and those who are really trying to take advantage of this global pandemic in pursuit of their ultimate goal, which is just to criminalize abortion and punish women. And then the last thing we're doing, of course, is there's an election coming up. You may have heard about it. It matters a lot. So we are organizing hard. Like I said, we have nearly 3 million members across the country. We have certain game changer states that we're focusing on. Those game changer states are places like Michigan, where we're playing defense for a Senate seat. We also need to win that on the presidential front. We have House seats that we're defending there too. States like Arizona, where we believe we can flip a Senate seat with Mark Kelly. We believe we can flip with John Hickenlooper in Colorado. We believe that we can flip. Sarah Gideon can beat Susan Collins, who took that horrible vote backing Brett Kavanaugh and saying that he wasn't anti-choice, even though it was written all over his record and all over his face, his misogynistic face. So we are putting a ton of effort into really making sure that we have a new president come January, that we have that Mitch McConnell is out of a job, and that we are able to hold the House. At the very least, we have to hold the House because it's our firewall. It prevents them from actually passing a full-on federal abortion ban that could then be upheld by the Kavanaugh Supreme Court. So that's a little bit about what's going on and what we're doing.
Thanks. That's a lot to be hopeful about, and also something that's very terrifying. So I don't really know where we're going to land on that, but that's good. But I think that brings to like Sophia and like the Women's March, which is like y'all, what we did in 2017 and everybody that stood there with signs and like protested. The world is different now. Like we can't be together. We're all on Zoom remotely. So what do we do? How do we protest from home? How do we hold power to account? As a commissioner, you see sort of government working in these different ways, but also on the front lines, you see what's happening. You know, for those of us that live in blue places, we're pretty okay, but not everything is for certain. But as Shannon mentioned, we have all these really important races to flip and places to defend. So what's working now? How do we do all this work during COVID?
That was a lot of questions in one, so I'm going to try to
answer any of them.
I think you got all my questions at one time.
I know, I'm sorry. Answer any of that, doesn't matter.
No, not a problem. I'm just gonna kind of, I took notes, so I'm gonna start from the top. How about that? So first and foremost, let's start holding these powerful entities accountable. And the way we do that is we support local businesses over big businesses. That way that ensures that our local economies can stay strong, so that our community maintains jobs and the benefits of employment, which of course includes healthcare, right? It's asking our elected officials and those in power to consider every piece of the puzzle. It's not an easy task, I understand, during a pandemic, and San Francisco has been doing a better job than most cities, that's for sure. But we need to ensure that no one gets left behind. And if we see that that's not the case, we need to demand for better. I want to give an example, and this is from the Commission on Status of Women. So unfortunately, the budget in San Francisco for city departments is going to be cut by 10 to 15%. Now, what this means for the Department on the Status of Women is that we have to cut funding for grant recipients who protect the safety of our cis and transgender women and girls. Basically, money is going to be taken away from assault and domestic violence crisis lines, emergency shelters, advocacy and legal services, prevention and education, and transitional housing. Now, this is just for the Department on Status of Women, right? And we know right now during this pandemic, gender-based violence as well as sexual assaults are on the rise, and which makes cutting these grants, these grants for these essential and critical organizations extremely tragic. We should be pushing our public officials to offset these costs by getting funding from private companies. At least that's one start. Fighting back from home means stay at home, please, unless you're an essential worker. But fighting back from home, really, we need to be staying on top of the news. Check your sources as well. I shouldn't have to say that. thinking to people on this call, but check your sources. We need to be paying attention to what's happening at the center of this pandemic and at the margins. Support local economies. Again, shop locally. Donate to organizations that are on the front line. This is especially important right now because nonprofit organizations, they use galas and events to fundraise, right? So right now they have to do it virtually. And I'm pretty certain they're not getting that funding that they used to get when they had these events in person. Another way, volunteer. Volunteer if you're able to in your community. Currently, there are a lot of food pantries that kind of popped up. And there's definitely a need for people to deliver groceries to the elderly and to other people in need. So please volunteer if you're able to. Also, volunteer and donate to pro-choice candidates, right? You can do that when you're from home. You can do it when you're at home. Donate to the places, to the states that is the most critical, right? In California, it's a lot different for us. So look to these other states that we know we need to win. We need to win those seats. So please make sure that you are doing that research and making sure that you are donating and supporting and volunteering. Register people to vote. There are so many organizations out there. I was on a call that basically trained these youth to do it. They created this amazing app. I forgot the name, but I will make sure I provide it after. But they created this amazing app to basically train the youth on how to register voters, right? And a lot of this can be done remote. Since more people are picking up the phone, help by phone banking. There are a lot of organizations that are doing phone banking, and a lot of times this could be for candidates. People are picking up their phone. They're sitting at home and they actually want to talk to people now. They're not hanging up on you. I used to do that. Now I actually pick up my phone. So call, do the phone banking. Protesting. Protesting looks a lot different, or should look a lot different, because we're seeing in some places it's not looking a lot different, except there's a lot more guns at the other protests than there was never any at Women's March San Francisco, I'm just saying. But protesting looks a lot different, right, during the pandemic, and it should look a lot different. Safety should always be priority, and people really should be social distancing right now, not just for their safety, but for the safety of other people. And I understand right now there's so much injustice happening that continues to happen, right? This is something that just will not stop. Injustices in every arena, including people fighting, making it harder for people to get access to abortion, right? But we're seeing everything else right now. And the best thing to do is not be on the streets right now. And the reason for that is we really, really need to consider these the essential workers, the doctors and nurses. We do not want to fill up the hospitals, right? We do not want to make it harder for our essential workers, for the people working at the hospital by basically all showing up there because we ended up being at the same rally and a couple of people were sick, and now you have 100 people that are sick. So definitely do more protesting from home. Lastly, this is what I've been doing mostly since the pandemic started, is really use this time to connect with people and to educate yourself, right? In this case, we're being educated about reproductive justice and access to abortion, right? And how this pandemic is being used as a weapon right now to take that right away from individuals. So please educate yourself on the inequities that this pandemic is exposing more and more each day. And one of the best ways of doing that is this, right? Is by attending virtual meetings. There are so many popping up. I can kind of get into the second part more of the Women's March part if you want, or if you want to kind of send it off to somebody else and come back to me, I can go into a little bit more detail from Women's March side.
Let's circle back because I want to come back to some action items. So we have 10 minutes. This has been incredible, and I want to make sure that we get to a couple more questions. So we're going to click through these pretty quickly. So as Sophia mentioned, there are other places, other candidates that are pro-choice champions that need our help. Heidi at Vote Pro-Choice, we focus on down ballot candidates, pro-choice champions. What are they doing to really make an impact in their community? Can you talk a little bit about that direct sort of correlation between a candidate and then being elected and saving abortion?
So I'm going to put something in the chat. It's the Vote Pro-Choice Local Impact Report. We put it together last year. It describes how every single elected office on the ballot impacts reproductive freedom. Statewide agricultural commissioners, they're like a direct line to governor, particularly in red states. So you want to make sure you're doing pro-choice agricultural commissions. You've got water commissions in Massachusetts. The water ordinances that were passed by elected water commissioners were used to prevent a zoning of an abortion clinic in Framingham, Massachusetts. We know San Francisco. I was on the board of the National Institute for Reproductive Health, which was NARAL New York back in the day. And we started something called the Local Impact Report, localrepro.org, which describes what a pro-choice city really looks like, what reproductive freedom in a beautiful urban environment. Guess who the #1 pro-choice city is? San Francisco. And so therefore that's good news, which means that we've been very innovative, but we can always do more. And so it looks like a mayor supporting policies to make sure that reproductive rights, birth control, abortion is covered in city employees' health insurance. It's something, it's the sheriff handles pregnant, incarcerated people in a way that's respectful and healthy. It is a district attorney who will not prosecute a woman for self-inducing an abortion. So it's so important to vote pro-choice in every single race, particularly because it's also a leadership pipeline, which goes to the bad news. Because we have not been investing in leadership development through the lens of reproductive freedom, and the other side absolutely has for the last 30 years, we've got a lot of folks at the highest levels of government, the Senate, the Supreme Court, the president, they're using abortion rights as a means of control. And so therefore, what is our solution here? It is, we kind of have to orient ourselves carefully and not get overwhelmed and not get disoriented and focus, because we have to remember that we can actually, with a little bit of effort, elect great candidates. I'll give you one example. So what we do at Vote Pro-Choice, and you can sign up for our voter guide and get and see great, and also our website has all of these great down ballot candidates, like Railroad Commissioner in Texas, all about reproductive justice and clean water and clean access to rights of way, right? So for example, one of the candidates that we would support is somebody like Jennifer Carolfoy, who was running for the Virginia House of Delegates. She was running in a primary in 2017 against a perfectly fine Democrat, but she was running on trying to prevent the Virginia required transvaginal ultrasounds. She was a public defender, a woman of color, happened to be a pregnant woman who was a graduate of VMI, just a rock star. So we helped her get elected. She won her race by 10 votes. She won her primary by 10 votes, ended up in the House of Delegates, helped pass the Equal Rights Amendment that is now she was like the organizer of the delegation that got the last state to pass the Equal Rights Amendment in the United States Constitution. And yesterday she announced that she's running for governor of Virginia. And so that is why just simple little investments in these down ballot candidates transform the world, you know? And so that's where you want to get your San Francisco values out into the planet, and also hold your elected officials locally accountable for the many different policy aspects that they can do to expand reproductive freedom.
Yeah, a lot to work on. I want to think about a couple last thoughts as we dive into these last few questions, and then our final question for all of you is going to be one action item for all of our attendees to take with them as we leave this space and we think about waking up tomorrow and fighting the fight. So just put that on your radar coming up. But Layidua, I want to think about what's happening at these places of service, either clinics, healthcare providers. Like, what is happening to human beings who want to get care? How is access being diminished, attacked, restricted during COVID? And what can we do to support people who need healthcare during this time?
Yes, so Shannon already mentioned that more conservative legislators are using COVID as an opportunity to enact restrictions or sneak in restrictions to abortion in aid packages. So it further limits access to abortion in states that are already experiencing lack of access. And as it pertains to here in California, that means that we're more impacted. We provide services for folks who are traveling into California to receive services. The reality is that people who need healthcare, the people who need access to abortion, will do whatever they need to do to get that access. And so we are taking calls from our neighboring states quite regularly who are traveling into California to receive the services that they need. This obviously means that financially it's more, people are more impacted. Also really thinking about how many people are losing their jobs during COVID, and a lot of people are depending on their employer-provided healthcare in order to receive the services. So folks who might have had coverage through their employer are now losing that coverage and are relying on state funding, which in many states is there isn't state funding allocated for abortion access. In California, we're lucky. We are in a state that has a very strong constitutional protection of abortion, and we do have money set aside specifically through Prop 56. A lot of money is set aside for family planning and abortion care. As the economy is shifting, we're actually now currently dealing in our policy work that the governor wants to reallocate money that is typically going into family planning to regular Medi-Cal. We understand that it's a pandemic. We understand that Medi-Cal needs to be funded. We also need reproductive health care to be funded. And so it really is one of those things that where both things are necessary, and folks, as the new budget is being looked at, that is one of the first places they're thinking of cutting. So it really creates additional barriers for folks who are depending on public funding for their access to abortion. And again, as I mentioned, in access, we are receiving calls from neighboring states for folks who are losing their either healthcare or access. We are fortunate that in California, clinics have yet to close, and they've been super creative. Access has supported clinics in, we're not necessarily trained to do so, but they give us a list of things to support in screening the patients who are coming in to receive services, to make sure that we're also keeping our clinic providers safe. So it is one of those things where we have to, as services are impacted, we also have to think about the safety of our service providers. And finally, a lot of public transit folks depend on buses and trains to get to their service areas, and those are impacted. So we're finding ourselves paying a lot more for taxi rides and car shares because of services to get to the clinics.
Wow. Thank you, Shannon, for dropping this into the chat. I want to make sure everybody sees that Access is California's only abortion fund. So if you feel like being generous, go there. Really quickly, Shannon, I want to talk to you about Roe v. Wade, Supreme Court. We got stuff coming down. As of Monday, they're going to start making announcements every Monday from here on out. So Mondays can be even more not great during COVID. What do we do about these cases that are coming down? Like in terms of what the services part, right? Birth control is healthcare. Getting a mammogram, going to a place that provides access. If you want family planning services, maybe. What is the threat and what do we do about it?
Yeah, I think the first thing to keep in mind is that both cases that we're talking about here, the case related to birth control and also the case related to abortion, this is all, again, just perpetuating the same agenda of the Trump administration, which is power and control. right? This is all about controlling women and pregnant people and keeping us down, and that is like written all over everything that they do. So in the case of June Medical Services versus Russo, this is the first major abortion case in front of the court since Kavanaugh was confirmed to the Supreme Court. This is identical to a case, Women's Health versus Hellerstedt, out of Texas just 4 years ago, which was struck down by the Supreme Court. So we are literally looking at the same exact law under consideration, and the only thing that's changed in that 4-year time is the composition of the court, right? So we know that we have anti-choice justices, Neil Gorsuch and Brett Kavanaugh on the court now. What it pertains to, this pertains to a hospital admitting privileges law. It's out of Louisiana. And essentially the consequence is that if this law is upheld in the court, it will effectively ban abortion in the state of Louisiana. There are currently just about 4, I believe it is, abortion providers there. There would be a single abortion provider that would still qualify to have hospital admitting privileges in Louisiana, but he has already come forward and said that he would just have to fold, basically, that it would be too much. So let's think about the impact of these abortion bans we're talking about nationwide. Whether you write it into statute as an abortion, as like an actual, 6-week ban or a total ban, or you do this same kind of method that they've been using for years and years, which is the chip away at access, where we already know that we exist in a patchwork quilt of access across this country, with California being one of these islands, where fortunately we are able to do what Layidua just said, which is provide care to people who are coming in from other states. We have places like Illinois, who are also, have a pro-choice government, and it can be an island of access in the Midwest. But if this goes through, then what we're going to see next year is the same thing we saw after Brett Kavanaugh's confirmation of the court. Next year, state after state, any anti-choice state is going to be introducing new hospital admitting privileges laws, because that would be their way to effectively ban abortion in their state. So we really, I think, just have to funnel this into what this is all about. As it relates to the Little Sisters of the Poor versus Pennsylvania, that's about birth control. That essentially would say that you could lose your birth control coverage just because your employer, no matter who they are, has some religious objection to that. It is a super broad interpretation of religious freedom, and really dangerous. The risk is that hundreds of thousands of women would lose access to birth control. And it's interesting, as soon as I said women, I have to say too, as we talk about language, I do think that the other place that we have started to more successfully move into as a movement is recognition that it is not just women who are pregnant or need reproductive healthcare services. And so typically we will actually use the terminology women and other pregnant people because it's essential. So that's what's at stake. And the biggest thing that we can do actually is that the Chief Justice really cares about the integrity of the court, and putting him on blast as for what this is, for how he is compromising the integrity of the court if he is to uphold the Louisiana law, if he were to take away our birth control. He has a lot of big issues in front of him this time around. And if he is going to just strike down civil rights issue after civil rights issue, he is serious. He is making it clear that the judicial branch right now is just the third leg of the, extreme right. And so I definitely think that we have an opportunity. He does care about the integrity of the court. And if we can hold him to that and make it clear to him that this would compromise that, I think that's really our only shot.
I like that. That leads us into our last sort of question. We're going to tie it into Sophia's part around Women's March and action items. As we leave this space, and it feels heavy for a variety of reasons. I would imagine that all of us are sort of dealing with what's happening in our universe. I want to arm us with things to do that are positive and make a difference, and you can feel good about moving us forward. So my last question to all of you, and we'll start with Sophia, is what is one action item that we can take away from tonight and move forward, empowered and ready to go?
Thank you. For me, I think the best thing to do is get involved however you can. Every time that you sit at a table, you're in a room, you represent multiple experiences and identities. For me, that's being a woman of color, queer, first generation Lebanese American, first generation to go to college, and a war survivor. And all those intersecting identities are in a room demanding to be a part of that conversation. So please get involved in whatever capacity you can. Even if you think it's small, it makes a difference, I promise you. Your voice needs to be heard. So please just make sure your voice is being heard whenever you get the opportunity. If somebody isn't giving you the opportunity, scream and shout and get that opportunity. It's okay not to be nice. So just stand up for the marginalized communities, have your voice get heard, and just get involved. I'm gonna cheat. I also wanna say vote, please vote, 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 and fill out your census. People do not talk about this enough. You should be filling out your census. And if you have family that does not wanna do that, make them. I made my parents fill it out. You can make your parents fill it out. So please make sure you fill out your census. Thank you, everybody.
Okay. Next. What else? What else can we do?
I will go. Shannon, thank you for putting in the link. I'm adding an additional one. We are actually in the middle right now of our, what would have been our bowl-a-thon. It's our largest annual fundraiser, and it fundraises a third of our operating budget, anywhere from $150,000 to $200,000. And as mentioned on the call, because of the lack of capacity to get together, it's really impacted. So while our bowl-a-thon fundraising usually closes at the beginning of May, and again, anywhere from 150 to 200,000. We're still trying to fundraise, and we're currently only at $9,500. And this is 1/3 of our operating budget. I know that on the call earlier, folks said support states that are most needy. I always say yes, definitely. And also, we here in California are providing services for those states that are nearby us that don't have access to services. And again, because the travel is longer, sometimes we have to cover hotels in very different ways. Our expenses are also higher. So please, 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 if you have the capacity, donate to the bowl-a-thon. If you are excited about fundraising, sign up and support us. And fundraising, we will be fundraising through the end of June. Also, piggybacking on Sophia, please vote. Many of us, myself being undocumented, can't vote. So your vote really counts for those of us who cannot vote for ourselves. Thank you.
Absolutely. Shannon?
So, I mean, I guess if I give you one thing, it's become a NARAL member. But beyond become a NARAL member, become a NARAL reproductive freedom activist. Our reproductive freedom activists are basically our next level. They're our volunteers. They are the people who really show up. They make calls. They make calls not just for the election, which is so critical, but also for the advocacy efforts we're engaged in. This year, we're working on a bill to expand access specifically to maternal health care, and basically what the bill does is it removes physician supervision for certified nurse midwives, which is like kind of wonky, but it is super impactful because California is actually only one of 4 states that still requires that. And we have massive actual access deserts for maternal care in California, and we continue to have a really serious gap with Black women dying at 3 to 4 times the rate of everybody else in California. So there are lots of things that we're doing. That bill is opposed by the California Medical Association at the moment. They're very powerful. We could use your help. So I would say become a reproductive freedom activist with us, because then you can sign up to phone bank and help us hold the house. You can phone bank and or text bank or put on an event or do whatever it may be to help us organize for advocacy that has impact.
Definitely. Heidi, what else? What do we got?
I just want to say I'm really excited to be in partnership with the panelists here on this call. Vote Pro-Choice, because it is a project of a revenue-generating organization or revenue-generating company, we do not have to raise money, so we get to promote other people's asks, which is delightful. So I have 3 very specific things to do. 1, we have the Georgia voter guide, which is active right now. Georgia has a primary election on June 9th, and it's going to be gnarly. Everybody knows somebody in Atlanta or someone in Georgia. So get the voter guide into their hands. And this thing is amazing. We have a recommendation in all, I think, 2,000 races in Georgia. So we went and researched the school board members and the judges. So you don't have to. 1. Number 2, we will do a national voter guide that will have the 95,000 races in all 50 states, DC, and the territories, including California, with recommendations in every race. So sign up to make sure you get that, because it'll help you. Number 3, do take the actions that the folks on this call have said. Join NARAL, give to NARAL, give to Men for Choice, give to abortion funds, put your money where action needs to happen, because reproductive freedom is really at stake right now, my friends, and how grateful that we all are to have access as San Franciscans. And of course we have to be investing in expanding access in our communities, and there are foundations that are willing to give lots of free birth control grants, so go for those. But take those actions that the other panels have said.
Definitely. I am going to drop the voter guide in the chat really quickly. Oh, there it is. Thanks, Nia. Okay, we had one question from a attendee around the Senate races that are really important to flip. So we could get the Senate. It's in play, which is a really big deal. So Shannon, can you remind us who we are? We have Colorado. Who else?
Yes. Okay. So there's actually a lot in play. Colorado, we think we can win with John Hickenlooper. You may remember him. He ran for president once. And we believe Mark Kelly can win in Arizona. He is Gabby Gifford's husband. Now he knows how it feels. That's how he's identified.
Also an astronaut.
Most importantly, yeah, he's an astronaut, but most importantly, he's Gabby Gifford's husband. So North Carolina is also in play with Cal Cunningham. Maine is in play with Sarah Gideon. Even Iowa is in play, possibly with Joni Ernst, unseating Joni Ernst, who's one of the worst anti-choice senators we have.
She's the worst.
And so that would be to support Teresa Greenfield. And then there are a few other, we're playing defense in Michigan, Minnesota. Those are our most important defensive moves, but we need 4 Senate seats. We need a net 4 to win. And the Republicans are playing a lot of defense right now.
Yeah, adopt a senator, please.
Yes.
I'm going for Maine. Oh, Susan Collins. Oh.
We will send those states out in ways to connect. A lot of us in the blue places can have a really big impact in other places that are red or purple that need more energy. So as we're all home, we can text, we can chat, folks. Any other questions for our panelists? We have like a minute left before I have to sign us off, but any other questions? Anyone?
I miss you all very much. Thank you for all the work you do, man.
Yes.
You taught me well.
Yeah, thanks you for organizing. This is great.
Yes.
Yeah, thanks to everybody that joined, and thank you to the United Democratic Club. Thank you guys so much.
Yes, thank you. So we will email out all these resources, all of these lists, every way to get involved so that you can feel empowered and take action and keep fighting the good fight. So take care of yourself, stay safe.
Did you want to take a photo? Somebody said photo.
Oh, yes. Yeah, turn your video on, let's take a photo. I think Steph's gonna do that. So if you want to turn your video on.
Hey, everybody.
Where is she?
All right, let's say 1, 2, 3.
Oh, there she is. 1, 2, 3. Did it work? Did it work? I think it works.
Did it work?
Great, it worked. It worked.
Yay!
Thank
Thanks for sending that out to all of us.
Take good care.
Good night.
We will talk to you soon.
Bye, guys. Bye, Teresa, Women's Building.
Yay, thank you.